All right, everyone, welcome to the webinar, What Your Doctor May Not Know About Cardiovascular Disease. My name is Dr. Sean Adams. Thanks for joining us. We're going to go ahead and get started here. If you have any questions, go ahead and hold them until the end, and we'll try and have time for them, and I'll answer a few of them. Any that we don't get to answer, there'll be an email at the end that you're welcome to send me over your questions via email, and I will get them back to you as soon as I possibly can. All right, so with that, let's get started. So first off, I'd like to run through a quick disclaimer, just letting you know that I do pride myself in providing the most up-to-date research, literature, and clinical outcomes. The following has not been evaluated or approved by the FDA or its governing bodies. Recommended dosages for adults. As always, any treatment should be monitored by a licensed physician. So basically anything I talk to you about today, don't just run out and grab some stuff off the shelf and take it. Make sure you actually consult with a physician before you do anything along those lines. So let's start with heart disease itself, and what is it? What's it doing in our world? How's it compare with some other killers? So heart disease is actually the leading cause of death in the U.S. right now. It's killing almost 600,000 people per year, and cancer is a close second. What they don't tell you is right in through here are preventable medical errors. So we're actually, errors that are essentially preventable in a hospital setting or a medical setting are actually killing 200,000 people a year, but they don't put that in there in the research. But there are articles out there, and that actually is a low estimate. It could be up to 400,000 deaths per year. Still puts it in third place, no matter how you look at it. But it's pretty scary that is the average of what could be happening. But we're here to talk about heart disease, so let's keep going along with that topic. So let's look at some statistics. So this is via the American Heart Association, all these statistics. So in 2012, 29.9% of adults reported engaging in no aerobic activity. Less than 1% of Americans met 4 out of 5 healthy diet goals, meaning they ate what they were supposed to in the proper amounts. Children ages of 2 to 19 are becoming more and more overweight by the year. Last statistic was 31.8% are overweight and 16.9% are obese. Childhood obesity or childhood diabetes is also on the rise. Millions of adults diagnosed with diabetes type 2, 8.2 million suspect to be undiagnosed. So not only do we have 8.2 million people that are undiagnosed, we also have 38.2% of the population as pre-diabetic, and almost 20 million adults are diagnosed with diabetes already. So it's an epidemic, and it closely relates with cardiovascular health, as you will learn as we discuss this more in depth. Coronary heart disease causes 1 in 6 deaths currently. And in 2010, 34% of cardiovascular disease related deaths were before the age of 75. So, 75, most people still have a good quality of life left. And the fact that 34% of those deaths were before that, that's kind of scary. So in the news, let's talk about what things are being talked about with cardiovascular disease in the news. Antidepressant and NSAID combo. NSAIDs are like Tylenol, Advil, that kind of stuff. Combo linked to brain bleed risk. High levels of vitamin C may decrease ischemic heart disease and mortality risk. So just taking high dose vitamin C could decrease heart disease. And obese Americans now outweigh the merely overweight. So people are getting larger and larger every year, and not in a good way. So we need to really, do something about this, because there is a pretty big correlation with weight and heart disease. So that's one thing we need to talk about. I know it can be a touchy subject sometimes. People don't want to talk about weight. They don't want to, oh yeah, I should do something about my health. I should do something about my weight. But they don't really ever truly take it into their own hands. Well, that's why I'm showing you some of these statistics, just to show you that, it is important in life and for your life to be able to Control your weight, control your eating, and really work on things. And if you're having trouble controlling it, there's people out there to help you, us included. We're here to help people along the way. So one of the things that, this is actually a quote by my colleague, Dr. Brett, and it's so true. Doctors are no longer taught to think. Rather, they are taught to follow protocol, much like a cookbook, as to reduce legal action and media attention. The fear of political and financial ramifications far outweighs the patient's health and longevity. First, do no harm does not seem to apply anymore. Doctors are smart people. I've talked to a lot of them. They are sharp, they are smart, but they've become robots in a sense. They've really just started, like I said, acting like life is a cookbook. They hear a symptom and, they hear my stomach hurts, colonoscopy, or you need a proton pump inhibitor. Like, it's just an automatic reaction. It's a knee-jerk reaction as to what their symptom and their pharmaceutical or their treatment or their whatever needs to be. And there's no complicated, there's no complex thought process anymore. Like, the body works as a whole. You have to work with just more than one body part sometimes, but especially with the gut, like how many things that controls and how many things that can really work with. You can't just look at one part of the body and say, this is what you need immediately. That's just you take the blinders off and start looking and at the whole body. So their thought process, disease equals drugs. They listen to the symptoms, they attach a diagnosis, they find the drug that matches the diagnosis. And if there's a side effect, they find a drug to match that side effect. And it's obviously not working. So some of the things we're going to cover today: is cholesterol still the best test for heart disease? Where does sugar fit into this equation? Thyroid health, does it have an impact? Stay away from fat to stay healthy, and talk about some anti-inflammatory foods. It's not that diabetes, heart disease, and obesity runs in your family. It's that no one runs in your family. That's just a joke, obviously, but it could be slightly true. I mean, we really have to work on starting to exercise more. We saw in one of the previous statistics that Americans are becoming more and more lethargic every year. This chart is basically showing that there's a direct correlation with heart disease or heart attack, microvascular complications. So certain things like just vascular complications like diabetic neuropathy and that kind of thing, associated directly with HbA1c, which is your main test for diabetes. So essentially, the more at risk you are for diabetes, the higher your HbA1c is, the more chance you have for some sort of heart disease problem or vascular complication. Let's talk about how the cholesterol test is actually used. So a lot of times you'll get a cholesterol test run, and what you'll see is, now not on this one, but most of the time what you'll see is it'll say total cholesterol, and then it'll say underneath in subprint CALC, which stands for calculated. So what they do is they actually take your LDL, your HDL, and they basically have an equation that figures all this out. So if this were the equation for this example, your LDL is equal to your HDL minus your total cholesterol minus triglycerides divided by 5. Now that can all be flipped around if you wanted to test the actual total cholesterol. Now in this example, we're calculating the LDL. So if you remember algebra, you can actually flip all these numbers around to get different values if you're solving for X, essentially. But in this value, we're solving for LDL calculated. You see that in the VLDL CAL. That stands for calculated. So this is what it would be, which, in your mind might be like, okay, well, that makes sense. Like, why can't we calculate it? Well, here's the problem. If we're getting healthier, so to speak, and values are starting to level out, then why, if your triglycerides dropped, do you get a higher LDL? LDL is your bad cholesterol, for those of you who don't know. HDL is your good cholesterol. It's going to help clear the bad stuff out. But LDL is your more dense proteins. They're the ones that are going to be more commonly referred to as your bad cholesterol. So if your triglycerides drop, shouldn't your LDL be getting better? And if it's not, if it's going up, then don't we want to know the actual value? So one of the things we actually can do is we can run a test that'll show us actual values, not calculated values. little more on the pricey side. However, the cost, in my opinion, the benefit far outweighs the cost. Essentially, we're actually finding out the true values. We can actually get you the help that you need in the case that you're getting that test run. I don't think the calculated values are nearly as accurate, and I've seen in tests that they aren't accurate at all. So I like to run true values, not calculated values, if at all possible. So let's talk about the cholesterol truth. So a lot of people think that cholesterol is, you have cholesterol and it builds up plaque on the inside of your artery walls, and that's what causes heart disease. Like that's how it is. That's what we've been taught for years. And don't eat your eggs and don't eat your fats because they'll increase your cholesterol. Honestly, your cholesterol that you truly eat makes up a very small percentage in comparison to your actual total body cholesterol. Cholesterol actually is increased through inflammation. We're going to show you a little bit of that here as best I can. So essentially we have LDLs and LPA, which stands for lipoprotein A. Monocyte cell is an immune cell, essentially. So this is the arterial lumen is the inside of your blood vessel. There's a thin single cell wall, and then there's a lining around that vessel called the arterial intima. So what happens is there's the monocyte converts to a macrophage cell whenever there's times of inflammation. Certain dense LDLs and lipoprotein A will cross over that barrier. So have you ever heard of leaky gut? It's whenever there's so much inflammation that there's gapping in between the cells, and essentially things get into the gut that aren't supposed to be there. Well, this is like leaky gut, but in the heart tissue, in the vascular tissue. So things that aren't supposed to be there are getting there because of inflammation. Well, at that point in time, that macrophage acts like Pac-Man and gobbles up the oxidized LDL and the lipoprotein A. When it does that, it becomes what's called a foam cell. Well, those foam cells, they build up plaque underneath that that wall that is between the lumen and the actual outside of the cell. So what we get some remnant lipoproteins that come in, and they do the same thing. They come across, the macrophage eats them, creates more plaque, and then eventually that plaque will rupture, and that's what we when we have heart disease that we have people have issues with. So it's actually not forming on the inside of the cell wall or the intimal wall. HDL will come through and it'll actually remove the excess lipids. That's why HDL is considered the good cholesterol. So we want to see a better HDL to LDL ratio. So here's what I was talking about. You can see how a normal artery, you have a cross section, you can have good flow. But you can see in the second picture, the narrowing artery, there's actually a thin wall. So the plaque's not actually building on the inside layer. It can't just like lift off and throw a clot at any point in time. It actually has to rupture through that. And that's all caused through inflammation, because if you don't have inflammation, you don't have that immune response. You don't have that happening in your body. So that's something that we really need to focus on, is decreasing inflammation in your body. Usually that's through food, because we don't want to see this happening. So the right test makes all the difference. So what test do we actually run? Well, in our office, we run what's called the Cardio IQ panel. This test is a fantastic panel. What it does is it actually tells us actual values, and we can run through and see the actual values and then treat accordingly. So you see this patient here has great triglycerides, but all their other cholesterols are screwed up. Lipoprotein A is good, but apolipoprotein B is screwed up. So then what does this all translate to? Well, essentially, when we look at this and look at all the values, we want to see that your cholesterol essentially has a good pattern to it. And what I mean by pattern is we want to see that your cholesterol is light and fluffy, or big and fluffy like a pillow. The smaller and more dense it becomes, the easier it slips through those walls, and the more prone to heart disease you actually are. So in this case, this patient is a high peak size, so they're actually meaning their risk is their particle size is it's more B-based. So the B-based particle sizes are actually the dense proteins that we don't want to see. We want to see those light, fluffy proteins, essentially. Gut connection, there's a strong gut connection with heart health and probiotics and gut health in general. So here, probiotics and their fermented food products are beneficial for health. Not only beneficial in sugar control, but also in cardiovascular disease. Potential probiotics in controlling cardiovascular disease. There's lots of research out there that's showing the benefits of the two, because the less inflammation of the gut, the less inflammation of our body as a whole, and essentially we're seeing that that inflammation of the heart going down. We're not having as much heart disease happen. But how does sugar affect us? Fructose is consumed. We get increased lipopolysaccharide translocation. And basically what's going on here is we're having an immune response. That the LPSs translocate, the lipopolysaccharides translocate. They bind to the immune cells, and then those immune cells generate inflammatory cytokines or inflammatory markers. And then those inflammatory cytokines basically alter the inflammatory load, meaning they're creating more inflammation in the body. So sugar essentially is creating more inflammation. That's the important part, the important takeaway of this slide. And that's, like I said, inflammation isn't just local. Like, just because there's location just in this area doesn't mean it's only ever going to get to that area. Problem is, the immune system has to fight the entire body, and the more upregulation of the immune system there is, the more inflammation there is, the more problems you're going to have overall. I gotta get through this whole thing again. Okay. Another comic: to prevent heart attack, take 1 aspirin every day. Take it out for a jog, take it to the gym, take it for a bike ride. So, I mean, that's a lot of doctors like to do the 1 aspirin a day, baby aspirin a day. Like, I don't think that, God didn't create the aspirin to help us thin our blood. So, I mean, we really don't. That's not the thing. We need to actually get out there and be active and start taking care of our bodies. So the secret killer, the surprising link between inflammation, heart attacks, cancer, Alzheimer's. Time did an article on this. So essentially, Dr. David Seaman, great doctor, did a nutritional review on how a diet-induced pro-inflammatory state, or essentially how a diet can induce a pro-inflammatory state. Because it's rare that a physician includes dietary therapy and nutritional therapy in patient care. It's sad, but it's true. But nearly all degenerative diseases have some sort of underlying biochemical makeup, and that is diet induced. So, I mean, we really need to look at that as a factor. Although specific diseases may require specific treatments, we really need to look at nutritional protocols and reduce that inflammatory state to help the person overcome these. Otherwise, they're just going to be on pharmaceuticals for the rest of their life. So if your goal is to be chronically sick and tired, the current American diet is the perfect way to attain that goal. Otherwise, we need to change something. This is always an interesting thing that I've talked about before. We learned in school, like, all sorts of fun things. It's kind of a weird one, though. Not a lot of people know about it. And I don't love to bring it up, but sometimes what I'll do is I'll be talking to someone, and I'll notice, as a patient, I'll notice they have this diagonal earlobe crease, and I'll ask them about their heart history and all that, and we'll start going through some questioning. It's a really great segue into talking about heart health, because quite honestly, it's weird, but it literally is a very strong correlation with atherosclerosis and heart disease. I went backwards again. This is what a diagonal earlobe crease looks like. And like I said, the correlation between the two is very strong, like strong enough that it's actually a real thing. So if you got that, let's check you out. Let's see what's going on. I want to make sure that you're not going to have a heart attack soon. That's definitely a worry for sure. And just because you have the earlobe crease, you can prevent things. Don't think that genetics is a death sentence. Genetics can oftentimes be like a light switch, and if you don't give the body an inflammatory state, you can keep that light switch turned off, which is a pretty cool thing. So raising sugar raises the risk. So the more sugar you have in your body, essentially, we looked at how that activates inflammation, how inflammation can eventually lead to heart disease and plaque buildup, and this is another example of it. High blood glucose stimulates HMG-CoA reductase, which is going to promote atherogenesis, or the promotion of the plaque production. And sugar will also raise insulin, or can raise estrogen. So in men, that's a bad thing. That's why a lot of men will gain weight. Diabetic men will gain weight in their chest and their belly. And again, we can see how there's a layer of cells in between the plaque and the actual where the blood flows. We can see how it can make a narrowing for sure. So I'm not going to go over this slide in too much detail. Just know that there's drugs that treat things, but there's also a lot of things that we can do naturally that also can decrease these values as well, and they're just not being talked about. Berberine, for instance, is has shown to be as or more effective than metformin, and metformin causes B12 deficiency. It's often misdiagnosed. There's lots of things that are happening here that we can help. With knowing what's going on, and with proper testing, we can promote healing through healthy lifestyle and supplementation. Additionally, patients with depression have been shown to have abnormal hydrogen breath tests after consumption of fructose and the other sugars. Elimination of fructose resulted in improved depression. So sugar equals depression, essentially. Hydrogen breath test is a way to see if you have bowel overgrowth of certain bacteria, and essentially we're showing here that there's a strong correlation with fructose and neurodegenerative disorders, absolutely, and neurotransmitter disorders. So you have an increase in glucose, your insulin then it goes up, but the problem is that also equals sodium retention. So whenever we have glucose and insulin going up, then we stress the kidneys out as well. So a lot of patients, I will say of almost all patients that have increased glucose and diabetes, will at some point in their life develop some sort of hypertension, whether sooner or later. At some point in their life, they will. And honestly, the reverse goes the same. If they have hypertension at some point, they will eventually have diabetes. I would say greater than 90% of the time. So it increases fluid volume, raises blood pressure, and stresses the vessels and cardiac tissue. Here we talk about some more of the drugs. So if you're familiar with ABCDEs of hypertension, ACEs or ARBs, so end in pril or sartan, like lisinopril, for instance. You run the risk of increased potassium, angioedema risk due to preserved bradykinin or a chronic cough. Beta blocker, like metoprolol, calcium channel blocker, peripheral vasodilators, direct thiazides, promote mineral depletion such as potassium. So there's lots of things that are just causing issues whenever we talk about pharmaceutical drugs. They may make your numbers look good, but they're really not taking care of any of the problem, which really means they're not doing anything. Another reason to avoid sugar. Glucose challenge stimulates reactive oxygen species. So the more sugar you eat, the more reactive oxygen species you're showing up. So that'll decrease antioxidants. You can last at 3 hours. So there's lots of inflammation going on with sugar. Again, that's the big takeaway from this. Lots of inflammation. Inflammation is going to cause just all this cascade of events to happen. Oral 100-gram portions of carbohydrates from glucose, fructose, basically any type of sugar, orange juice even, significantly decrease the capacity of neutrophils or the immune system to engulf bacteria. So, and that's up to 5 hours after feeding. So literally large portions of carbohydrate decrease the ability of your immune system to function. 100 grams of carbohydrates is not as much as you might think. Like you're looking at that probably going, man, that's a lot. That's like 4 pieces of bread. So I know I can eat like a lot of pizza, and that's probably a lot of carbs, just saying. So, I mean, and the thing is, we're eating carbs all the time for the most part. Like you think about it, we have sugary yogurt for breakfast, because yogurt isn't just yogurt anymore. It's got lots of sugar in it. or eating a bagel for breakfast or a donut or cereal. Cereal is one of those ones, oh, it's good for your heart. No, it's not. It's loaded with carbohydrates. It'll break down into simple carbohydrates. Now we got all these cereals out there for kids that are loaded with sugar. So, and then for lunch we have a sandwich and maybe some other, some fruit, which fruit can be good, but if you're not having any vegetables at the same time, you're not slowing down that sugar being digested. And then for dinner, we're having bread and pasta and potatoes and all sorts of things. So literally, we could be in this chronic state of inflammation and decreased immune response for most of the day. If you're talking about 5 hours after feeding, that could be up to 15 hours of your day. And it's not a good state to be in constantly. And that's just how our society is functioning. And that's why we get sicker and sicker every year. The cardiomegaly and renal hypertension. So as the heart works harder, the walls become thicker because they're working harder, which isn't a good thing. You're like, oh, my heart's stronger. No, that's not a good thing. It's not. You don't want thickening of the walls of the ventricles. And your kidneys actually get smaller. They decrease in function. You have higher urinary protein. So there's a lot of things that are caused by the increased sugar diet and all these things that are happening. Again, back to the glucose increasing, which increases insulin, which causes sodium retention, which causes problems in the kidneys. And kidneys regulate your blood pressure. For those of you who don't know that's what actually helps regulate your blood pressure. So 1 out of every 3 U.S. adults has high blood pressure. And from 01 to 09, antihypertensive have increased by 15%, while multiple medications have risen. People on multiple medications have risen to 57%. Patients need to be reevaluated regularly for dosages, and a lot of times they're not. That's the other scary thing. So Dr. Mark Houston is at the Hypertension Institute of Nashville, I believe. And he basically says hypertension is not a disease. It is the correct but chronic dysregulated response when an exaggerated outcome of infinite insults to the blood vessel with subsequent environmental gene expression patterns in which the vascular system is the innocent bystander, resulting in vasoconstriction and hypertension. So essentially, it's an innocent bystander. It's because of all this other stuff going on, your body's trying to correct itself, but because it's correcting itself against all this bad stuff, it's causing diseases and problems. So it's just becoming a more and more issue that we're seeing every day. Fasting. So we have all these drugs that help out with hypertension and high blood pressure, etc. So here's a study on medically supervised water fasting only in the treatment of hypertension. Recently, I actually had a buddy do I think it was a 30-day water fast. He said it sucked while he was doing it, but afterwards he felt fantastic. Just because of how clean his body felt. He felt like he could sleep well again. It was kind of an interesting thing. I don't recommend that, especially not unsupervised by a medical professional, but it was kind of a cool experiment he did to himself for sure. But water only fasting for as little as 10 days, so a third of what he did. 90% of the subjects reduced their blood pressure on an average of 37 over 13 millimeters of mercury, or that's what his blood pressure is measured in. Pretty crazy. Water only fasting. Hypertension and the thyroid. So another strong link. Dr. Barnes felt that there was a link between the high BP and hypothyroidism. So a lot of people that have hypothyroidism have high BP and vice versa. So he started reviewing his records over a 10-year period, and over 95 of the 95 patients who presented with hypertension and hypothyroidism, 95% or 90 patients showed a significant decline in blood pressure after treatment for hypothyroidism. So there's a strong connection there. So if we were treating the hypothyroidism, their blood pressure actually started decreasing. I'm encouraging you to go get your thyroid treated naturally if possible, and get the right markers run so you can get your thyroid treated naturally. Hypothyroidism and atherosclerosis. Subclinical hypothyroidism associated with 260% increase in the prevalence of heart disease. That's pretty crazy. So, and that's a fairly large subject size, that 25,000 or 2,500 subjects. Thyroid and heart function. So high insulin, high blood sugar are decreasing thyroid function. And thyroid hormone controls heart rate and metabolism. So there's definitely a strong connection between that, your hypertension, your heart disease, all that kind of stuff. So a decrease in thyroid hormone decreases cardiac function. The removal of thyroid receptor in mice causes the cardiac dysfunction. So you're starting to understand why why heart disease is such a simple but complex thing. We're dealing with so many aspects of the body and how they relate to one another. You can't just look at heart disease, look at the vasculature, and deal with it at that site. You have to start correcting other things, because if you deal with, you give someone a pill for one thing, you're not correcting all these things that are causing the issue. And until you correct those things, you're not gonna fix that issue. That's why we have to start with diet and start with certain supplementation and start working our way towards the ultimate goal of removing the antagonist. Another Time magazine. Eat butter. Scientists labeled fat the enemy. Why were they wrong? Science was never wrong. It was unethical manipulation of data to benefit the few. If you start going back in history and looking at some of the data around dairy and margarine and butter and carbohydrate and grain, it's pretty interesting. I'm not going to fill in my thought process, but essentially it's pretty interesting to look where the science actually was and how the body works and how the media portrayed a lot of things and how they don't line up whatsoever. And all truth goes through 3 stages. First, it is ridiculed, then it is violently opposed, finally it is accepted as self-evident. It's pretty crazy to think about. Because of all these things, we've started to have a fat phobia. So the myth of eating fat makes you fat. Fat is absolutely essential for lots of things in the body, including vitamin D production. It's an anti-cancer, GI health, immune system, skin issue, all that stuff. That's all vitamin D. Fat and mineral absorption. Fat's essential for that. Vitamins A, D, E, and K and CoQ10 they need fat to be absorbed into the body. Every cell membrane in the body is made up of fat. Nerve health, so nerve conduction. There's what's called myelin sheaths around nerves, which helps with nerve conduction. They are made of fat. Immune function, regulation of T cells, again, very important with fat. They need fat, essentially. Hormones, all hormones are made from cholesterol. So I don't know if you guys have noticed this trend, but so several years ago, probably when I was just a little kid, maybe even before, I don't know. But I've researched this, so that's the reason I do know about it. But essentially, we started thinking that cholesterol was the issue, or fat was the issue. So we started putting people on statins and fat-lowering drugs. So the next thing that started to come out was all these things for erectile dysfunction and low T and all these different things. That's because our hormones are made from cholesterol. And when we start lowering cholesterol, you can't produce your hormones, things like testosterone, things like estrogen, things like progesterone. Every hormone in your body comes from cholesterol. So it stands to reason that if we're lowering our cholesterol to stupid low levels, why we're having hormone issues. And then, like I said, again, it comes back to the cookbook where doctors are prescribing medicine and pharmaceuticals to a symptom. And then when they have a side effect, they prescribe a pharmaceutical to that side effect. Next myth, egg yolks increase cholesterol. We talked a little bit about this earlier. When compared to the yolk, the white of an egg is deemed useless if not accompanied by the yolk. And that is absolutely true. So we need both in order. Now, if you're eating like 6 or 8 eggs a day because you're doing bodybuilding, I can see taking out some of the yolks. But if you're eating 2 or 3 eggs, eat the whole egg. Like, it's going to be much more healthier for you, much better complex blend of nutrients along with the fat. The Framingham study, which is the longest running heart study currently. Majority of individuals who develop coronary events are not in a high-risk group. According to the Framingham study, assessment of traditional risk factors for coronary heart disease. And because 1/2 of those who suffer myocardial infarctions or heart attacks have normal lipid values, measurement of inflammatory markers has been suggested as an adjunct to lipid testing to better identify individuals at increased risk. So 1/2 of the people who have heart attack have normal cholesterol levels. So that's the reason why we're saying inflammation is more of the cause, because a lot of these levels aren't being measured correctly either. We're not measuring the small, dense lipoproteins. We're not measuring the inflammation surrounding all this kind of stuff. So we need to be watching out for that. Dietary cholesterol only equates about up to 7% of serum cholesterol. I mentioned that earlier. There's the actual number. Ibuprofen-like activity in extra virgin olive oil. So literally, long-chain fatty acids increase diamine oxidase activity, thus lowering histamines. So we're literally creating an anti-inflammatory effect just by eating extra virgin olive oil, or drinking, or whatever. However you consume extra virgin olive oil is up to you. The one thing I would recommend is not to heat your olive oil. It'll actually break down. So use things that are more tolerant to heat, like coconut oil or grapeseed oil. That's with a G. Because there is rapeseed oil, and that is not the same. So you want to use grapeseed oil, coconut oil. I believe avocado oil is good as well. It doesn't break down under high heat like olive oil does. Olive oil should be used for coating things like salads or different vegetables or whatever you want to do. You just drizzle a little bit on, and that's going to be where you get your good profiles of fat from. Yolk versus the white. So we look at the white, we look at the yolk total, and all the values in the yolk for all these different nutrients are over 50%. So all your nutrients, with the exception of 2, 3, 4, 5 nutrients, are found in the yolk. All your vitamin A, all your vitamin E, all your fat-soluble vitamins, A, D, E, K, doesn't list it here, but choline is found in eggs. It's probably it's one of the top 5 sources of choline in our diet, and it's one of the most readily eaten sources of choline in our diet, because I think the highest is liver, and I know not a lot of us like to eat liver. So I think egg yolks are at number 2 or 3. And choline is very important for brain health and lots of other things in the body. Consuming both the yolk and the white give the greatest nutrients, but if one had to be chosen, it would be the yolk. Yolks are also very high in choline. Oh, there it is, which improve all body functions, especially neurological. Oh yeah, so there it is, number 3 in choline. So not a lot of us eat wheat germ, and I wouldn't necessarily recommend it in high amounts anyway. Not a lot of us eat liver. So eggs are the most commonly sourced. Yeah. So the incredible edible egg, the original advertisement still stands. Whole egg consumption improves lipoprotein or cholesterol profiles and insulin sensitivity to greater extent than yolk-free egg substitutes in individuals with metabolic syndrome or diabetes. So eat real eggs and eat the whole egg. It'll help you with all this kind of stuff. Incorporating daily whole egg intake into a moderately carbohydrate-restricted diet provides further improvements in the atherogenic lipoprotein profile. So your plaque cholesterol profile, plaque-generating cholesterol profile, and an insulin resistance in individuals with METs. Vitamin C, genetically high plasma vitamin C intake of fruit and vegetables, and risk of ischemic heart disease and all-cause morbidity. So essentially, high fruit and vegetable intake cause less heart disease. You can get your vitamin C from all different sources. Make sure, like I said, again, get vitamin C, but make sure you're eating your vegetables too. It's very important. Judging by the effect size, our data cannot exclude that a favorable effect of high intake of fruit and vegetables could be part and driven by high vitamin C concentrations. It's also a really good antihistamine. It's an antioxidant. Here you can see 10 minutes after 2,000 milligrams of vitamin C, hives on this patient are gone. So humans are lacking in L-guanylactone oxidase, thus making vitamin C essential. Potassium. Potassium is a big one because potassium is an actual alkalizing agent, and it will help essentially excrete toxins because when your body becomes more alkaline, you get your potassium from big sources of vegetables and that kind of stuff. It actually comes from potassium citrate. So That's where you want to get your potassium from. And Paleolithic man consume higher potassium and lower sodium. A lot of things today have sodium in it. But as your body becomes more alkaline, you have a higher efficiency of removing toxins, and you have a higher immune efficiency as well. And you deal with stress better, you lower your cortisol, all sorts of things. So potassium is definitely an important thing. And if we can get our urinary pH to be alkaline, we know that we're taking enough potassium in a day, or eating enough potassium in a day, which is why we truly need, and lots of fruits and vegetables are alkaline, which is why a lot of people need to be eating more fruits and vegetables. Resveratrol is a pretty cool nutrient. It's a rather expensive nutrient, but it's a very cool nutrient. Like I said, it's got anti-aging effects, anti-cancer effects, and it can mimic exercise in its effects. It's pretty cool. Again, you get it from grape seed and grape skin. So that's why it can be kind of pricey, because I don't know if you've ever seen a grape seed, but most grapes don't even have seeds anymore. And the ones that do, they're real tiny. You don't get a lot from it. And again, the skin is super thin. There's not a lot to be had, but that's where it comes from. So what to eat? I love this. Try organic food, or as our grandparents called it, food. It's kind of sad, but it's so true. Low glycemic fruit, such as dark berries, cherries, grapefruits. So I'm a big fan and proponent of blackberries, blueberries, raspberries, cherries, all those. Avoid tropical fruits, dried snacks, or concentrated juices. Lean proteins, wild-caught fish. Stay away from tilapia. That stuff's, I think, grown in a bucket. Free-range beef and chicken, again with the eggs too. Great source of protein. Colorful organic vegetables, so make sure you're getting a broad spectrum of the rainbow in your vegetables. So kale, carrots, cabbage, artichokes, peppers, everything. Pretty much all vegetables, with the exception of corn and potatoes, are pretty much good for you. Nuts and seeds, all but peanuts, and rotate them weekly. So peanuts are not a nut, they're actually a legume. They're very moldy. They have lots of things like aflatoxin and weird stuff that's bad for your liver. So eating them in large amounts can cause issues. Nuts, sometimes people can create food sensitivities to them. So just rotate them. So don't eat almonds for like 6 months in a row. Like eat almonds for a week, then macadamia nuts, then pecans, then pistachios, rotate them. The solution, here we go, bringing it all to a close. Eliminate simple sugars, starchy carbohydrates, and wheat. Enjoy good fats such as olive oil, coconut oil, and nut butters, excluding peanut butter. Again, peanut butter is not a nut butter, it's a legume butter. Increase activity more than the routine. So don't just go through your routine. Go out and walk, run, go to the gym, exercise. Drink plenty of pure water. Avoid toxins, allergies, and harmful chemicals. Along with that, the vegetables will help you eliminate those toxins that you might already have. And if you need to test for what you're allergic to and all that, talk to your doctor, or we can help you with that as well. Ask your doctor about proper tests to see if you are currently at risk. We run the proper test is the key there, and we can run that in our office, or you can talk to your doctor about running it in your office at home. Eat to live, don't live to eat, even though food is delicious. All right, so you can email me any questions at drshawnadams@gmail.com. I'm going to try and field a few here before we get off. If you need to give us a call, 970-532-2755. I can call you back at my earliest convenience, or we can answer your question right at the front desk. And check out our website. We got lots of cool stuff there. Our Facebook page, our Instagram, all that kind of stuff. We're constantly posting articles and really cool information for you, the consumer. Our goal is to be able to educate you guys. Don't blindly follow anyone. Not your doctor, not me. I don't care. Educate yourself and learn what's going on. That way you can go and understand, or at least ask questions to figure out more. And don't be afraid to ask your doctor questions. Don't be shy. Don't just blindly accept what he gives you or she gives you. Just just ask questions. Why? What's the point of this? What's the end game of this? Where are we going? What's this going to help? Like, just ask those kind of questions. Is this the right test for me? Essentially. So let's see. Let's answer a couple questions here. how does fish oil play into heart disease? So fish oil is kind of a cool one. Omega-3s are really important in heart health. But the problem is with omega-3s is we're seeing a lot of research lately that says like, oh, fish oil doesn't work, omega-3s don't work. The problem is they're researching the wrong values. So if you're going to do research right, essentially. So what we're finding is that we need to see EPA and DHA levels in fish oil, a combined value of greater than, I believe it's 1,400 milligrams. So when we're seeing values of 1,400 milligrams in a dosage, that's enough to raise your omega-3 index. But you need to be taking that high of a dosage to feel better, not necessarily, but to see values start to increase, you need to be taking those dosages for over 90 days. A lot of problems is these research articles are showing people are showing lesser values. So they're showing like 500 milligrams or 800 milligrams, and they're only doing 30-day tests and not 90-day tests. So they're not doing the test long enough to actually see the benefits. So they're doing a low value and they're doing only a 30-day test, and they're saying, oh, it doesn't work, so stop taking it. Well, then that gets out in the media essentially, but we're not getting the whole story again. So you really need to look and see if the whole story. Another question here. If I'm in Pennsylvania and you're in Colorado, how do we work with each other? So we do telemedicine here at the office. The office here has been around for about 20 years, and they've been doing telemedicine for a long time. If you have the technical savviness, we can actually set up Skype or FaceTime or any of those things to actually visually talk to each other. But I can order tests, I can send tests, I can send supplements. We can do a lot here in the office and send things across the nation. And we can talk with you about pretty much anything. We can order tests in your hometown. It works out really, really well. Obviously, we would love to see you in person if we could, but that doesn't work for everyone. Not everyone has the access to a doctor in their area that does this kind of work. And we have 4 doctors. So there's only 300 doctors in the nation that have the diplomate in diagnosis certification. And 4 of those 300 are actually in this office. So it's kind of cool. We have a really lucky makeup of this office, and it's pretty cool. But yeah, we have been doing telemedicine for a long time, and we absolutely love to do it because it gives us a broader spectrum and a much more the ability to treat more people and help more people in their lives. All right. Let's see. Do you recommend going gluten-free for heart health? So a lot of times I recommend people not going gluten-free because a lot of gluten-free things still have simple carbohydrate sources. So carbohydrates, for those of you who don't know, a lot of people don't know what a carbohydrate is. So it's sugar. It's anything sweet, so candy, anything like that. Sugar is a carbohydrate source. Fiber is a carbohydrate source, but it's not a bad carbohydrate source. It's actually good. And then there's everything in between, like grains, bread, pasta, all that kind of stuff. That stuff turns into simple sugar, and that stuff turns into problems and inflammation in the body when eaten out of control. So we really need to limit all grains, not just gluten-containing grains, but in my opinion, all grains. We need to limit those because, gluten-free doesn't equal healthy necessarily, or gluten-free doesn't equal weight loss. You know what I mean? So we really need to look at going, more so grain-free or grain-limited. I really like a carbohydrate-restricted diet. I'm not saying carbohydrate-free, but carbohydrate-restricted, and really focus on getting your carbohydrate sources from lots and lots of veggies and maybe even a couple or some fruit thrown in there as well. So that's all the questions I'm going to answer online today. However, I want to thank you guys for joining in. If you have any other questions, contact me at drshawnadams@gmail.com or give the office a call. They'll write down your question and then I can give you a call back. Or if you have any questions about how anything functions here at the office with telemedicine, we can work that out as well. Again, thank you so much for tuning in. Check out your email. We're going to be sending out a special offer for those of you who attended live, and it's going to be something that you can utilize if you decide to work with us via telemedicine. So Again, thank you. I hope you enjoyed it, and stay tuned for more of these as time goes on. We look forward to them. They won't always be from me. It'll be from all the doctors in the office, but we're definitely excited to continue them. Have a good rest of the night and a good rest of the week, and we'll see you later.